Thank you both. This evening I talked to the former Health Secretary Jeremy Hunt and asked him if he was confident that with the changes announced by the government in the past 48 hours, we were now in the best place to fight the virus.
Absolutely. I wasn't last week. I was very nervous that we were going down the mitigation route, which said that we wanted 60% of the population to get this virus to create herd immunity. And I think the government absolutely rightly has looked at what would actually happen to the NHS if we did that strategy and has seen the NHS would not be able to cope.
Do you think we are better prepared now? You've been hearing today from the boss of the NHS. Are frontline staff being protected, and are the necessary preparations now there?
Two specific things today came up which we must sort out very, very fast with respect to frontline staff. The first is testing. On Friday we stopped community testing. As things stand now, you know, if you're a GP and your daughter has a fever, you're off work for 2 weeks. And I think many NHS staff find that immensely frustrating. What worries me the most is that on Friday we stopped community testing in this country because the decision was to prioritise hospital-based testing. And when you stop community testing, you don't know the prevalence of the disease in the community. Now, today we heard from Sir Patrick Valance that they would like to reinstate that as quickly as possible. But that's why we need that South Korean style massive ramp up in testing.
In practical terms, are you confident that the NHS frontline staff have got the right protective equipment that they need and are getting the right messages now? I mean, they've been told to keep working, some of them, even if they're displaying symptoms. This is anecdotal evidence, but do you feel they are being properly supported?
As of today, there are big gaps, and that was what we focused on this afternoon in the Select Committee. I think it is totally wrong that doctors and nurses are putting themselves in harm's way, and you've seen the heartbreaking scenes in Italy. And, you know, doctors do die on the front line when they're dealing with this epidemic, as we've seen tragically in China. They have a right to have the proper protective equipment, and there are too many gaps at the moment. The good news we heard this afternoon was the NHS does believe it has enough equipment, but it's not getting through everywhere, and this does need to be sorted out as an absolute priority.
And you talked a little bit about the lessons that we will learn from this. I remember back in June, you said to me that you regretted that cuts to social care had gone too far. I mean, when you look at where we are now, do you think, as the longest-serving Health Secretary, there were things that you would have done very differently?
For sure. I mean, you can't do a job like that for nearly 6 years and not end up thinking there are things that you wish you'd started. I mean, I'll give you my number one thing, which is that I wish we'd started training more doctors and nurses earlier, because it takes 7 years to train a doctor, 3 years to train a nurse, and we need more doctors and nurses in the NHS. Social care is another one. Look, without getting into the politics, I did believe that it was necessary to make very painful cuts in public spending in 2010. But in retrospect, I can see that the cuts to social care were in a way the most silent, but also the most devastating. And, and I think that when the government comes forward this year with its plans for social care, I really hope that we put it on a sustainable footing going forward, because I think it's desperately important.
Jeremy Hunt.